One of the very first nursing jobs that I did was working as a new nurse, on a med-surg tele night shift floor. And I remember getting information, or actually overhearing, about this major mistake that a new grad nurse made. And what happened was, there was how like many times before a patient's discharge, we will ask them if they had the flu vaccine, the flu or pneumonia vaccine, depending on if they also qualify for pneumonia. So it was normal to usually give a patient their flu vaccine, right? So I guess one time the charge nurse, this happened during day shift and I was working night shift, the charge nurse, she had passed by, I think she had either passed by or she called for help, you know, the day nurse. She passed by the room and she saw the day nurse giving the patient the flu vaccine through their IV line. So then what happened, once she saw that, she pulled her, without doing it in front of the patient, she pulled her aside and told her like what she asked her what she was doing, and she said like, yeah, I'm giving the flu vaccine. And then she did a little more, asked her a few more questions, and then she said like, yeah, this is how I always do it. So of course the charge nurse went and reported her immediately, and then she was fired. So the thing about it, the thing about that, fortunately, no patients were harmed or hurt. And as you know, the flu vaccine is not supposed to be given IV. It's supposed to be given IM. And it matters the route that you give a medication. It matters because this is a whole nother discussion as far as pharmacokinetics and absorption, distribution, metabolism. Because when you give a medication through IV versus whatever the route is supposed to be given, it's going to work a lot faster and have a higher potency than it's supposed to. So luckily, like I said, no patients were harmed, but this is why I'm honestly it may seem like I'm making fun of or whatever, but we can't afford to make the same mistakes. We can't, because patients' lives are at risk, So I share content so that people can become aware of the reality of what we're doing, as far as like the nursing profession, us being aware of what we're doing and what's right and what's wrong.